what is the key metric you measure in your business that's most important
Yeah.
to you?
So the key metrics at the end of the day, it comes down, look, as healthcare providers, we need to make sure that we're delivering good service. Especially if, most of your people that are watching this will be from a clinic, making sure that your NPS score is absolutely bomber. You need people to be appreciating and enjoying and engaging with your service and that they'll want to refer your service to someone else. So making sure that you're tracking NPS across all of your clinicians is absolutely vital. So that's, you build it from the service level up. Then, after that, are you documenting clinical outcomes? Because you'll want to get good clinical outcomes. And so, making sure that your clinical outcomes are documented really well. So those two elements are the objective things for the clients documented well and are the NPS documented well. But following that, you know, um, you got to make sure you're measuring your return on investment for your marketing initiatives. So you're measuring where your money is being spent and how many people are coming in at an absolute basis. And then you're measuring ROI on a per employee basis. So, is each employee at least paying their way and a margin that you're comfortable with? Following that, if you're like even before you're setting up your practice, will your business be able to bill enough money with the amount of beds that you have in your business to at least make sure that the rent isn't a disproportionately large amount of your turnover. And my golden rule is that you want to get rent down to around about 5% over a long term for how much rent contribution is on the overall cost compared to when it's fully booked. 10% is a reasonable sweet spot. You're trying to drive a 15-ish%, 15 up 20% profit margin, above and beyond your own wage as an owner. It's the clinical care at the end of the day. It's the customer service at the end of the day. So you've got to make sure that you're hitting both customer service, clinical outcomes, and then being prudent with the rest of it.